Hey everybody, this is CJ. Just giving you a little update on my surgery recovery. So it's 15 days post-surgery, so just 2 weeks and a day. And I had my follow-up today. Things went well. They took out the first layer of stitches. I don't know if you can see that. So here's kind of the scar right here. So it's healing up pretty good. There's internal sutures in there that will eventually dissolve. And I got to talk to the doctor a little bit today. The surgeon actually performed the work, and it was really cool getting his feedback and finding out exactly what they did. So I'll try to throw up the images of the MRI and try to explain it if I can. So here's a picture of the MRI before surgery. I kind of circled the area where the UCL sits, and any white area, like where I'm pointing, that's kind of signature of a tear. And then the little black canal that kind of is below there, you want it to all be the same thickness throughout. And as you can see, it's kind of like pinched there, so that just shows that it was torn, and so it's thinner there. But basically, I did tear the UCL, ultracollateral ligament here in the arm, and it was a pretty bad tear. Originally, he told my wife that there was plenty of tissue and that everything went well, but he gave me a little bit better breakdown of kind of how it looked. There was still part that was attached, but there was quite a bit that was torn off. At least the thicker part of the ligament was. So they were actually able to suture it back to where the tear actually occurred. So what they did is they sutured it back up, and then what they did is they put the anchors in with the UCL brace, and it's laying over where the sutures are. So what, in his experience, what he said is, everything will, it'll heal back. They'll kind of grow together. I can't remember the name of the brace that they use, but at any rate, it's a synthetic brace. It's coated in collagen. When I had the surgery, I did opt to have the PRP cells put in at the surgery site. So that's supposed to help promote growth and healing. So you do pay a little bit extra for that, but ultimately I'm trying to get back as quick as I can. So he got to tell me, kind of where it was torn, how bad it was. One thing that did happen, I've got, still got decent mass on my arm, but when they went to cut me open initially, for some reason with the anesthesia and everything, my bicep actually swelled up. And so they said they kind of had to work around that in the surgery, and but they were still able to do everything that they wanted to. Surgery actually went longer than what they thought because of the severity of the tear and having to do the sutures to try to put it back together before they put the brace on. So I've got pretty good range of motion. So I don't know if this is, so my arm's not completely straight yet. And, this, I'm just kind of using my weight here. Whenever he did the surgery, what he actually did, what was kind of cool, is he kind of compared the movement to this arm. So he tried to mimic, how this arm rotated to when they put the sutures in the brace to try to match it up as evenly as possible. So can't say enough about his name's Dr. Michael C. Dorn. He has 3 offices in the Tampa, Florida area. And so it was really cool getting his feedback. He also had the surgeon, an additional surgeon that was there. I guess it's his assistant, but she's actually a surgeon as well. And so she kind of got to tell me about it as well. So, so what was the verdict after 2 weeks? So I'm healing well, to be expected. They actually had to cut part of the stitches out because I was healing so well. They said that obviously right now I'm not wearing the brace. They said it's kind of optional at this point, but if you're going to be around people, kids, animals, that kind of thing, or any, possibility of you falling, they want you to wear it just so you don't, do a like hard outside or inside, movement with the arm, the rotation. So he actually didn't recommend me getting physical therapy. He basically said, you look like a pretty fit guy, you'll probably figure it out. So I'm still going to do a little bit more research. he doesn't want me to lift anything for 6 weeks. If anything, I can, I can still pick up a grocery bag or that kind of thing, but no extensive like working out. Right now it's just letting everything kind of settle down. I still have a little bit of nerve issue with my pinky, so when I close my hand, I don't know if you can see that, my pinky doesn't quite curl all the way like this yet. So when I do it back here, it does, but then it kind of flatlines here. So, but every day it seems like it's getting a little bit better and better. It's hard to explain. It's maybe 2 to 5% better each day. And so I am seeing improvement. And, my hand, I'm getting more dexterity back. And that's just he didn't actually have to relocate the nerve. What he had to do was he just had to kind of move it out of the way. But he's like, some nerves are very sensitive. Sometimes if you look at them wrong, it can, disrupt things. It'll take a while for it, a few weeks for it to settle down. So that's the update I got. Like I said, I'll try to throw some images in there so you can kind of see exactly what the MRI looked like before surgery. And then they actually took an x-ray when I was at the doctor, and you can see where the anchors are. You can't see the brace itself, but you can actually see the anchors into the bone when they did the x-ray. So I'll keep you updated and let you know how it goes. All right, so here's a look at the x-ray, and I kind of circled where the anchors are. You can kind of see them drilled into the bone, but you really can't see the UCL brace, and they really don't reflect whenever they take the actual x-ray. But there's a look at kind of where it looks like and where the anchors are located.